All right, good afternoon, evening now. It's 5:17 p.m. We're convening a special meeting of the Thurston County Board of Health for December 15th, 2020. My name is Ty Menser. I'm Chair of the Board of Health. Vice Chair Commissioner John Hutchings to my right. Commissioner and Board Member Gary Edwards to my left. Calling the meeting to order, I guess. And we will start with item number 1, approval of agenda.
Mr. Chair, I move to approve today's agenda.
Second.
Been moved and seconded. All in favor, say aye.
Aye.
Aye. Agenda is approved. Call for approval of meeting minutes from November 10th.
Mr. Chair, I move to approve the meeting minutes from November 10, 2020.
Second.
Moved and seconded. Any discussion on that?
No, sir.
All in favor, say aye.
Aye.
Aye. Meeting minutes approved. Thank you. Item number 2 is opportunity for the public to address Board of Health. And we are in a purely virtual format with the boardroom closed by order of the governor. So our public comment will be through Zoom and conference call. And the county manager will check with the Zoom participants.
So I'm going to be calling on the Zoom screen for those names that I don't recognize being county employees. So if you are so, please accept my apology. First, I have Mr. Bill BoH. You'd like to provide public testimony this afternoon.
Thank you. My name is Bill BoH, and I have 3 elementary school-age daughters. Public schools are foundational to American society. Reopening schools should be a collective priority. The commissioners have stated that they do not have the power to reopen schools. Dr. Abdulmalik has stated that she is following the state's decision tree. Her comments have focused solely on one metric, the COVID activity level in our county. Lowering the COVID activity level to the current required level deemed safe to fully reopen schools is unlikely until the majority of our population is vaccinated. There will be production and distribution problems. There will be many people who simply refuse the vaccination. Herd immunity is months away at best, and there is no such thing as zero risk. Based on the current requirements for reopening, there is little chance our children will return to school this spring. Dr. Abdulmalik has stated several times that there have been outbreaks in educational settings, but there are no schools listed on the Thurston County dashboard as the source of an outbreak, and she has refused to provide specifics on said outbreaks. The lack of transparency has led to public distrust. I suspect that her refusal to provide specifics to the referenced educational settings is because they were in fact learning pods, not actual licensed schools. Learning pods bringing together multiple children from multiple families with multiple ancillary contacts inside, likely without masks, is far more dangerous than the safety and structure schools can provide. But parents have no other option, so these learning pods will continue and the spread of COVID will continue to rise. The decision tree, which is reductive at best, is guidance, not a mandate. School districts, big and small, have reopened successfully. Private schools in our own county have reopened safely and successfully. We should follow the example set by other districts and our local private schools, and at the minimum, give our parents a choice. There's overwhelming evidence that schools are not super spreaders. In fact, more children die per year in the United States from drowning than have died from COVID. We don't close pools. We teach our children how to swim. That doesn't mean that the virus isn't serious. It just means that children are not the target. The COVID virus itself is not the sum total of the public impact of the pandemic. Keeping schools closed is the antithesis of public health. It is time for transparency and collaboration. What are the real barriers to reopening schools? Parents are willing to lend their time, expertise, and financial support to reopening. Tell us what we need to do. All I want for Christmas is for my children to go back to school.
Thank you, sir. Next, I have Mr. Melanie Golib. You'd like to provide public testimony this afternoon.
Yeah, hi. Let's see, get my thing going here. My name is Kelly Golib. I'm a small business owner and a doctor of chiropractic who practices in Tumwater. I have 2 young children in the Olympia School District. I'm here today to ask our county commissioners and the Board of Health, who I know that, like me, we all want what's best for our kids, to please follow the science and allow schools to reopen immediately for in-person instruction. In our healthcare system today, physicians and hospitals are expected to follow evidence-based healthcare in their practices. The definition of evidence-based healthcare is making the best decisions based on combining the current research, patient preferences, and provider experience. Public health should be held to the same standard. Unfortunately, here in our county, the public health decision to keep our schools closed, even when our county COVID transmission rates were in the low risk category earlier this fall, has not been following this evidence-based criteria. Our county's public health decision makers have been ignoring the now large body of research showing that kids are safer in school and that keeping schools closed does not slow the transmission rates of COVID. And our county's public health decision makers have been ignoring the preferences of thousands of parents and kids in our county who have made it clear in surveys, social media posts, school board letters, and even organized protests that we need schools to be open again. In fact, it seems like the only part of the evidence-based healthcare definition our county has been using for the school closures decision-making process is the provider experience of our new county health officer. I would like to end with a quote from a recent scientific study published by physician researchers from University of Washington and UCLA, published in the Journal of the American Medical Association last month. This study concluded that there was a 98% chance that the total amount of years of life lost to our kids because of the academic damage of the first 2 months of school closures in the spring will be at least 5 million more years of life lost than it saved from possibly slowing COVID spread in our country. I'd also like to note that this is now a very conservative estimate because it did not take into account years of life lost due to increased suicides, increased childhood obesity, or the 4 additional months of lost school time this fall. Here's the quote from these physician researchers at UW. "We believe that during the COVID-19 pandemic, the United States has extracted an enormous sacrifice from its youngest citizens to protect the health of its oldest. During a pandemic, this may well be an ethically defensible trade-off, but only if resources are invested to reverse the potential damage to health and education that this strategy may inflict on a population with low visibility and high vulnerability." That's why we're speaking out. So thank you for your time and your leadership and your willingness to put kids first in our public health decisions here in Thurston County. Thank you.
Thank you, sir. Next, I have Ms. Melanie Golib. You'd like to provide public testimony this afternoon.
Yeah, thank you. So hi, my name is Melanie Golib. Similarly to Kelly, my career has been in evidence-based healthcare. For 10 years, I have helped perform meta-analyses of medical research across a broad range of topics. Last year, I took on a job with the World Federation of Hemophilia, managing their latest treatment guideline. We brought in experts and patients from around the world on hemophilia, which is a potentially fatal disease that interferes with blood clotting. And it was a monumental undertaking. The final submitted manuscript was more than 500 pages. So my point of telling you this is that contained in this document was detailed guidance on how patients with hemophilia could live their lives to the fullest as safely as possible. It included recommendations for playing sports, surgery, and all kinds of activities that would be life-threatening for people with hemophilia. There have been similar recommendations put out by scientific and medical societies regarding returning children to school safely amidst the pandemic. The American Academy of Pediatrics and the Centers for Disease Control strongly advocate for having students physically present in school due to their increased risk of morbidity and mortality compared to the risk of the same with the virus itself. So why, even when our county was in the low and moderate risk categories for 7 months so far of the pandemic, was there not a return to in-person learning? Why was our county not following the recommendations set forth by the state for returning to school? And why is the advice of one person more important than thousands of medical experts on returning kids to school?
Thank you. Let me go to the conference call. Good evening, those who have joined us via conference call this evening and would like to provide public testimony in front of the Board of Health. Please unmute yourself, state your name, where you reside in the county. You have 3 minutes. None, sir.
Thank you. Thank you for those who provided testimony. Item 3 for today's agenda is opioid response update featuring Katie Strozik, Social Services Program Specialist 2. I'm going to ask our Public Health Director, Shelley Slaughter, to introduce this item.
Thank you so much, Mr. Chair. In the interest of time, I'm going to go ahead and pass it straight over to Katie to lead into this presentation.
Thank you, Shelley. Commissioners, can I share my screen so that my PowerPoint jumps up?
Yeah, you should be able to.
Okay. All right, and just checking, does everyone see it as in presentation mode?
Yes.
Awesome. All right. So thank you, commissioners. I'm Katie Strozik. I am the Thurston County Opioid Response Coordinator. I'm going to try to zoom through this as quick as possible while giving you guys the most information. I know we're running on a little bit of a time crunch or a delay tonight, and I want to make sure that Chris also has plenty of time to present. So when I presented earlier pre-COVID to you guys, we kind of went over the goals and strategies of the Thurston County Opioid Response Task Force. At that time, we had just developed our 33 SMART objectives. Those are going to be goals that are specific, measurable, attainable, realistic, and time-bound. Again, these looped back to our 2019-2020 Thurston County Opioid Response Plan, which we are looking at still closing out at the end of this month. We have 6 areas of focus. I'm not going to run through those. I'll go over those in a little bit. So since I've updated you guys last time, we have completed quite a few SMART objectives. You can see on the PowerPoint in front of you. We've kind of divided them into different categories. We've completed 1 more in prescribing practices, 5 regarding access to treatment, much of that being in regards to medication-assisted treatment, 4 in naloxone and overdose response education, 1 in data, 3 in prevention, primarily being within safe disposal and safe storage campaigns, and then 1 within pregnant and parenting. So obviously we've had some barriers related to COVID-19 and some challenges that have come when the SMART objectives were set at the beginning of the year. We clearly as a group and as smaller work groups did not expect there to be a global pandemic that we were going to be faced with later on, and did not build our work upon that, that kind of framework. So mid-year over the summer, we went back and we had to adjust some of our SMART goals in order to either push out the deadlines or adjust them. Much of this came from SMART goals, which were built around the idea that we could have community education events or small group trainings, things of that nature, which were obviously limited as soon as we went into more restrictions due to COVID, where we were unable to hold in-person trainings or community events. Some of those things were having to be adjusted entirely. Some of them were able to be moved to a virtual format, fortunately. There was also a lot of changes on how local services were provided. So when we look at access to treatment goals, a lot of treatment was kind of reformatted to work on telehealth formatting, or they were limited in the number of patients which they were able to see due to having individuals physically come into a treatment center. And then also many of the staff who work on the Thurston County Opioid Response Plan are housed in the Thurston County government themselves and were reassigned to other tasks such as COVID response. And then also we had multiple staff at other organizations within our community who moved into either other positions or other organizations, which caused some transition within the opioid response plan work that we were doing. The good thing is you can see Priscilla Terry here. She wrote a great editorial for the Olympian that really noted the positives that we've faced during COVID-19. If you read her editorial, it's really awesome. She really focuses on how the benefits of COVID-19 have come to light during the task force work itself, specifically noting telehealth expansion, the ability to use telehealth to prescribe medication-assisted treatment, and then also the focus away from criminalization and looking at not criminalizing individuals or arresting them simply for possession charges, and how we can move away from this criminal justice-based model of arresting and how we can look more at treatment and more therapeutic models instead of arresting our way out of the epidemic. This kind of also ties into the current law enforcement assisted diversion program that the county is working on as well. So progress since the last update. We've been working on a community and workplace overdose education and naloxone campaign. It's really exciting to be able to share to you now that every single hotel and motel in Thurston County has been reached out to in order to be offered naloxone overdose education training, as well as naloxone kits. No one has said no so far, which is super exciting. And we've had many hotels and motels actually take us up on the offer, and they're now having staff who are trained in this, and they have naloxone on site in the event of an on-site overdose with a guest or a staff. We also offer this training to any business or agency in the community, but hotels and motels have been a major focus over the last few months. We had a great connection between the pregnant and parenting work group and our medications for opioid use disorder provider work group. So within our treatment work group, we actually have a meeting of just medical providers and individuals who work at medical or treatment agencies who meet on an every other month basis, strictly to talk about medication-assisted treatment and the barriers and systems that they work within. Our pregnant and parenting work group met with them 1 month, which led to one agency changing how they screen for pregnancy intention now, to try to work more proactively to connect individuals who use opioids with birth control methods to try to work more upstream to prevent pregnancy. We've been looking at sharing kind of what the task force is doing, as well as what we've learned with others at both the local and regional level. In the last few weeks, I've presented at both the City of Lacey's work group on homelessness, where they're working on deciding how they're going to create a homelessness response plan, and then also at the West Region EMS Prevention Council as well. And then we're looking to we're looking at creating a 2021-22 plan as we go into the new year and looking at how we can expand and address things like racial equity, and then expand to other substances, including over-the-counter drugs, as well as methamphetamine and polysubstance use. And my information is on the screen if you guys have any questions as well.
Commissioners, questions for Katie?
I do not have any questions at this point.
I don't have any questions at this point, sir.
Katie, I have a question. So there's kind of like two big questions. One is, are we implementing our plan? And then the second part is the plan working? And your information was targeted there at the first question. Thank you. And I'm just wondering, do we have any numbers about opioid deaths and overdoses? I mean, I know what I seem to remember hearing was that numbers were trending in the right direction before the pandemic, but after the pandemic, they started kind of trending up a little bit. Is that accurate, or do you know where we're at in terms of, you know, the bottom line metrics that we're trying to reduce?
Yeah, so kind of in two parts there. Are we doing what we set out to do, and is it working? As far as plan implementation, yes, we had to adjust some of our strategies, but the strategies that are still outstanding and not accomplished at this time, we're on track to accomplish all of our goals by that December 2020 date, which is really exciting, because had you told us at the beginning of the pandemic that we were still going to be on track, that would have been hard to believe. But we are on track to meet all of our metrics by the end of the year. As far as overdose death data, that one is kind of a hard statistic to measure as far as are we actually accomplishing anything right now? Overdose death data is going to be something that can sometimes take years to kind of measure against, just because death certificates take time, investigations take time, and things like that. And it's also not only looking at fatal overdose deaths. As we know in our plan, a huge area that we're looking at is overdose response education and naloxone distribution. So in that case, we could distribute a lot more naloxone kits and have a difference in potential fatal overdose deaths as a result. So using strictly overdose data doesn't necessarily show all of the great work that we've actually accomplished this year.
Thank you, Katie. All right, on to the next topic, which is item 4, climate change and health. We have Chris Hawkins here from Public Health and Social Services.
Good evening, commissioners. I'm going to share my screen for this presentation, unless Shelley wanted to say anything by way of introduction.
No, thank you. You're good to go, Chris.
Okay, hopefully I'll be able to get this to show up as the slideshow presentation.
There you go.
Does that look correct
right.
yet? Great. Well, so thank you, commissioners. It's a pleasure to be able to bring this presentation to Chris Hawkins, Program Manager with Thurston County Public Health and Social Services. I've been working on this climate change topic and its connection to public health for the last 10 years or more. It's something we've been aware of in public health, and so this is an opportunity to circle back and give you some additional information about the link between climate change and health. Particularly at a time when our community is working hard on taking action together to both reduce the possibilities of climate change health impacts and to adapt to those anticipated impacts. So I'm going to start off just by saying a little bit about the phenomenon that we're talking about here, which is climate change, and what drives that. So this opening slide just depicts the process of the greenhouse effect, which is actually a natural phenomenon that keeps our planet habitable. We have various gases in the atmosphere, which include carbon dioxide, methane, and other gases that help trap the sun's heat in our atmosphere, and that has kept our planet at a kind of stable climate for human activity and really all kinds of living things. What's happening here is that human activity is a big contributor to putting more of those gases into the atmosphere, increasing their concentration, and that's driving an increase in global temperatures of that atmosphere. So the air is getting warmer around the world. And it's basically the emissions of increased carbon dioxide and methane and other heat trapping gases that come from largely human activities, raising livestock, burning fuels that puts a lot of those gases into the atmosphere and serves to amplify that greenhouse effect to some effects that we really are concerned about, not only in public health, but in a wide array of public agencies and around our world in different communities. So a couple of key points I want to make in this presentation are that these climate impacts are affecting our health in this community, and that's in new ways and creating some new challenges. We've been experiencing some of that already in this effect of climate change on health. And it really does exacerbate some health challenges and issues that we've already had happening in our community, and we really need to pay attention to that through a couple of approaches. One is to adapt to those changes and anticipate what they are going to be and do things to help us become better able to deal with them, but also to mitigate, and that is to try to reduce the things that are contributing to climate change, trying to reduce our emissions of those heat trapping gases. And that's a big project that's something that the county has signed on to help with, and it's actually now in the county's strategic plan and in its comprehensive plan to do our part as a community to mitigate climate change as well as to adapt. And then, that's really that last point, is that we are working together with local partners to accomplish those goals of adaptation and mitigation to climate change. What are some of the anticipated impacts we have in our region of the world? Well, it really stems from that greenhouse gas emissions that are happening here. That's not just as depicted here from tailpipes of automobiles, but it's our use of energy in home heating and lighting our buildings. It's from, as I mentioned, raising livestock, emissions from a variety of sources that we have cataloged here in Thurston County affect this phenomenon. It's our share in what's driving climate change. What that leads to is a whole host of different effects. One is the increase in air temperature. That also affects ground and surface temperatures as well as water temperatures. It's expected to cause impairment to air quality, not only from what heat does by itself, but also because it serves to dry things out more. We're expecting longer summers with drier conditions, leading to drought more frequently in our area. And that puts more particulate into the atmosphere when you have drying conditions like that. It's also changing precipitation patterns. So think of our winters and how our mountains get covered with snow, blanketed with snow, and that's a big important source of water for our communities, even here in Western Washington, where we do get a lot of rain as well. And more of that's going to come down as rain in the winter months, and potentially with more severe storms, so more water happening all at once. That has some effects which we'll talk about in a moment in terms of flooding, but it also means diminished snowpack and some other issues related to that increased water at certain times of year, and not enough of it at other times of year. And finally, there are some impacts on the marine environment, not only sea level rise, which is a very familiar one, but also in terms of the chemical composition of the oceans and what that does to things that we rely on for food. So just walking through some of these weather patterns that we're seeing now. Climate is kind of what we expect. That's the big average pattern of things. But weather is what we get. And that can vary greatly from year to year. But in general, over time, what we're going to see more of is warmer temperatures. And that means that in the summertime, we're going to see more heat waves than what we're used to. And that diminished air quality, as I mentioned. We're going to see health effects from that in terms of respiratory health in our community. We're going to see effects on rates of heat stroke and heart disease in our community. Then in those heavier rain events where we might see flooding, we might see mudslides or other erosion and problems with our land being super saturated by rainfall, that can lead to food and water contamination. It leads to disruptions to what we have as normal things that we do, like transporting ourselves around the community, because it can cut off some of that infrastructure. And that's an increase in stress. That's an increase in barriers to people getting the services that they need, including health services. And finally, in that category of sea level rise or more water, we're going to see other effects, which I'll talk about more in a moment. I wanted to show some examples of impacts that we're already seeing here in Western Washington. This is a wildfire from back in 2017, pictures of southern Thurston County here. That had an immediate direct impact on people's health and safety. So this is something that is projected to occur more frequently here in Western Washington. And we've seen that as a pattern across the region. We've seen more fires and higher intensity and larger fires happening in recent years. There was good data on that. And then we saw even worse. So 2014 had the worst fire season ever. And then in 2015, we broke that record. And from 2016 to present, I think you can all remember the effects of some of the wildfire smoke that poured into our region, because we're part of a bigger macro region. in terms of the impacts of wildfire. So we had massive fires occurring in Oregon and California for the most part this summer, but the smoke came here and it had effects on people's health in our community and caused people to have to stay inside for an extended period of time in September. We're expecting those precipitation patterns to change. So the more concentrated precipitation, more frequent flooding events, and associated erosion and mudslides. And that does have a number of effects. As I've mentioned, the stress that occurs when people's homes and livelihoods are threatened by rising waters, the contamination that can occur with that, and barriers. And that flooding can be happening on a regular basis through sea level rise when we see a combination of storm event with high tides. We get flooding in downtown Olympia. This has been happening on a regular basis in the winters in our downtown of Olympia. With that increased water in the winter months and warmer temperatures throughout the year, we're going to see a change in habitats and in how things grow in our community. Mold is figuring to be a bigger problem than it already is. We're going to see vector-borne diseases. Those are diseases carried by insects, change in their distribution. Things like mosquitoes will be able to range farther and live long, maintain their populations throughout the year more. So that's going to affect our distribution of diseases that are carried by those insects, like West Nile virus. Ticks are another example of an insect that carries diseases, and those are expected to change in where they will show up. And we might have more of the disease, the Lyme disease carrying ticks in our region. Hantavirus is carried by rodents, and rodent populations will be affected also by climate change. And then finally, I wanted to mention just quickly about marine environments. With the increased concentration of CO2 in the atmosphere, that has an effect on the chemistry of the ocean, leading to more acidification. And that can affect our shellfish and how viable those are as a food source. And then there's even more acutely the effect of climate change in terms of more frequency of toxic algal blooms. And we see this happening right now on the Washington coast with razor clam season being closed right now due to a toxic algal bloom producing domoic acid, which is something that's not safe for people to consume a lot of. So this is having direct effects already in our region. So we have a part in this. We affect climate change, and we also are affected by it. And so there are things that we can do to address it. That's the fortunate thing about this, and I guess the hopeful message is that we're not helpless in relation to this. We have some strategies that we can employ to get us through this and hopefully mitigate it and make it less of a problem in the future. So it breaks down into a couple different categories of action. And one of these has been worked on already for a number of years, and that is adaptation, trying to manage the risks that come from these changes in the climate. That means attention to disaster management and preparedness. And we have a lot of experience with that, and it's good that we're getting that experience because we'll need to be ready for these kinds of impacts. Then there's a whole side of things which is called mitigation, and that involves trying to do things to reduce our emissions through better energy efficiency, through use of clean energy, and to try to move our society in a direction of basically cleaner and more conservation of energy. And a lot of that overlaps with adaptation. So that red figure in the middle there is the overlap of adaptation and mitigation. And as you can see, there are a number of actions there which have benefits in terms of our preparedness or our ability to withstand some of the impacts that are also good for mitigating climate impacts. An example of this would be local food production. If we have shorter supply lines to get our food to the people who need it, our many residents here in Thurston County. That is going to be a sort of a resilient strategy. It reduces our energy consumption if we don't have to move our food as far, and it helps us be prepared in the event of disrupted transportation systems from climate change impacts. Water conservation is another example of that. Energy systems where we're producing some of our clean energy here in Thurston County can be helpful on this. And a number of other strategies which have multiple benefits. And that's something we're discovering as we have been venturing into this part of climate action, which is called mitigation. And as the board is aware, this has been a long-term effort to work together with partners among the local cities here in Thurston County to identify some of those mitigation actions and put them together into a strategic plan, which is called the Thurston Climate Mitigation Plan. And just last week, as Commissioner Edwards knows, because he was there and has been a participant in it, the steering committee of that Climate Mitigation Plan project worked out and approved the new Thurston Climate Mitigation Plan. So we now have solid plans in place for both adaptation and mitigation in our region. I'm very excited to be at this stage of moving into implementing more of both of these strategies. I wanted to wrap up just by mentioning that this has been something that's been worked on in conjunction with Thurston Thrives. They put together this strategy map, which is actually lining up really well with the newly adopted adaptation and mitigation plans. Boiled down, it speaks to those exact same things that we've just been mentioning, our prime mitigation strategies. And again, this is all adding up to doing our part and is aligned with scientific targets that the county has agreed to work towards. This graphic shows those targets and a kind of projection of our emissions into the future would be that little squiggly line in the upper left of this graphic. That is our actual emissions measured. Those are trending in the wrong direction, and we need to work really hard together to bring our emissions down on that downward trending line towards the target of 45% below our 2015 emissions level by the year 2030, and then 85% below that 2015 baseline by the year 2050. So we're excited to be able to work on that. It's something that will involve work on the built environment and how our buildings use energy, as well as our transportation infrastructure and how we use energy in transportation, and agriculture and waste. There's a big part to be played by sequestration in the plan, which is how do we trap carbon and store it better, and that involves changes in agriculture and in forestry, and may also involve restoration of marine or Puget Sound estuary environments. I did want to show you, before I conclude, just a handout that I shared with the board that is also a document that is available and has been available for a number of years from Thurston County Public Health. And that is the paper that came from our study of the impacts of climate change. And this kind of summarizes exactly what I just went through. The list of different impacts is outlined here. And it talks about some impacts that I didn't really mention, which are some of these social psychological impacts that are big and long term. And I want to just make sure that the board recognizes and that we recognize as public health that it's going to exacerbate impacts, especially to vulnerable populations. And this is just another reason why we need to pay attention to health equity in everything that we do, including this strategy about dealing with climate change emissions. We want to look for those actions that will address the inequitable impacts of climate change on populations, so those health impacts, and also seek to create benefits from the mitigation actions that will go to some of these populations that experience a great disease burden or that will be benefited from clean energy and economic solutions that relate to that mitigation effort. So this is good information, and it is available on the Thurston County Public Health and Social Services website. I'll just highlight that here. Folks can find this on our special initiatives part of the health department's website, the full report. And that is all I have for you. And unless you have questions for me.
Questions or comments for Chris?
No, sir.
No. Okay, Chris, I have a couple of comments. I'm glad you brought up that last piece from the white paper, the social psychological. I also, slide number 9, which is the one you had up about, it said more water and warmer temperatures overall. Part of the reason I wanted the board to see this presentation in, just in advance of the consideration of the climate mitigation plan is to just, it feels to me like when people talk about climate change, many folks have a sense that, okay, it's happening and it's going to be impactful, but they see only limited impacts, like, okay, sea level rise, okay, we're going to have to build some walls and protect against flooding, and then life will go on as normal. And there are a series of impacts that I don't think people usually talk. Yeah, this is the one, because this whole slide is the kind of stuff that people don't usually think about: mold, habitat, vector-borne diseases, acidification of the ocean, and how that creates risk to food sources and aquaculture. I mean, the effects are so dramatic, wide-ranging, and interconnected. And then you added in at the end the social, psychological, and things that, again, things that relate to our health, things that aren't necessarily talked about every day when people talk about climate change. There seems like mostly people are talking about fires and flooding. Those are the two big ones, and and it's getting hot. And so, certain, vegetation effects and stuff. But thank you for just kind of laying out the sort of web of effects, and this will be good information and food for thought for the board and the commissioners when we consider climate mitigation plan.
Thank you. Yes.
Yeah, thank you, Chris. Did you have a comment?
I was just going to say that I wanted to add that mitigation plan will be coming back to the board for its consideration as to whether it wants to accept that and be part of the ongoing effort that is being called phase 3 of the climate mitigation effort, which is our implementation efforts towards getting those actions done.
Thank you.
Thank you.
Okay. Well, we are at 6 o'clock now, and we're down to our last substantive item. We do have reports at the end, which we can hopefully keep succinct. But we do have one item of business for the board, which is an emergency ordinance to extend food permit expiration dates. And Sammy Berg, I see in my upper left corner. Shelley, can I turn it straight to Sammy? Very good. Sammy, go ahead. I know Art Starry is here as well. If you guys can decide who's going to say what, but let's kind of just go through this quickly.
I'll go ahead and jump in there, and as we discussed this morning, we're going to be presenting a 6-month option, basically to extend existing food permits for food establishments for 6 months, and basically that will delay when they need to pay those permit fees. The permit fees themselves will remain the same. So based on our input from our fiscal staff, that we do have sufficient reserves to essentially float that balance until we do receive those in July. And this will allow some much needed relief to those businesses that are currently being impacted by the COVID restrictions.
Okay, trying to help folks out with a potential delay. Any questions for Sammy on this?
The only question I would have is, why can't we do that with all permits that will be expiring that are influenced by this COVID situation that we're faced with? I know people weren't able to put their septic tank in, for an example, and their septic tank might expire, the permit might expire. I don't know, you probably don't have the gopher thing, but I think the gopher permit should be extended as well. So I want to extend everything within your authority to extend that has a direct correlation to the COVID-19 as an impact.
Well, I can only speak for my section and the food establishment group, and so, but I don't doubt that Art and Shelley can look at other aspects. I do know that the For instance, the septic permit processes have already gone through their renewal process for 2021. And in most cases, there has been arguably less direct impact on all the people with septic systems versus food establishments being directly told that they had to either close down or restrict how they do their business. And so this was a real easy and obvious group of people to try to assist. But I'll leave it up to Art and Shelley to review and look at those other permits.
Well, no, I'm with you, Sammy, on this deal. I just want to go farther down the road, that's all. So they don't have to do it right now.
Mr. Hutchings.
Gophers aren't a food source yet, though.
It would be if it was up to me.
People don't realize, Sammy, that food permitting is not just a restaurant. It's not just a wagon or the lunch trucks. It's markets and such too. And I'm very much in favor of this. Does it take effect January, or does it take effect like right now, or when does it take effect for 6 months to extend it? Whenever the permit expires?
It'll take effect now. The normal permits are set to expire February or January 31st. We'll push that out to July 31st. And there are approximately 1,000 food businesses that will benefit from that delay.
I asked this before because we've discussed this several times. That impacts revenue to the county, but not so much that it's prohibitive.
Correct. That basically that there are reserves sufficient to cover that delay in receiving those funds, and there's the intent basically is to hopefully allow businesses the chance to recover their business so that they can actually afford to pay those fees rather than face the alternatives of closing. And then that obviously impacts them, but certainly also impacts us through not receiving those fees at all.
Excellent. Thank you, sir.
Sure.
Just quickly. Now, therefore, the Thurston County Board of Health hereby reads as follows. In that first section 1, the last sentence, section 1, this section shall not apply to temporary food establishment permits. So how come?
Mainly because those are issued for a particular event. And so those permits are should be much more individual. And also since we are not doing any temporary food festivals and things like that at this time, basically the main impact and benefit would be for the annual food permits that are existing.
Okay, I mean, if it was up to me, I'd scratch that sentence out anyway. And when something did break and there was going to be a wedding or somebody was going to have some activity at a venue, let them have it. God, we went a long time without permits.
Well, we do have a responsibility to still go out and make sure everyone's food is safe, and so do need to recover some of that effort.
He was not listening.
I got two people talking.
I'm sorry.
Sammy, can you please finish your comment, which I did not hear?
Yeah.
Sure. We do have a responsibility to make sure everyone's food is safe, and so for those temporary events, we do still need to have staff go out and do the inspections and whatnot for those events, and so those fees are more directly related to that, and it kind of goes hand in hand. If they're not allowed then to hold those activities, then there's no permit needed. Once we are able to go back into those kinds of events, we will be, they'll be happy to actually hold the events and to do their business. And having the food permit is a pretty minor part of that process, as opposed to the annual permits and businesses that are ongoing.
Okay.
Mr. County Manager.
Sir,
Okay.
he addressed what I was going to say.
I think you kind of hit on my question, but I'm just going to ask it again for you to hopefully nail it down. Can you explain how, hopefully you're going to have a really good explanation as to why this act by the board does not compromise health or safety? Like, let's say the governor opens restaurants on January 5th. Is there something about our processes that's still mindful of our safety and health
Yes.
concerns?
So the food program and its inspectors and the inspections that we conduct, the reviews we do for all of the things, the disease investigations that we do, all of that continues as per normal. The only thing that we're doing is basically delaying for 6 months when we're asking those fees to be submitted. And so we will continue to be doing everything we normally do to provide for the food safety of the community. This is only a fiscal adjustment, basically, to provide some fiscal relief.
Perfect. That's what I wanted to hear. Thank you.
Sure.
Is there a motion? Are we ready to?
You bet, 'cause I like this. Mr. Chair, I move to approve an emergency ordinance H-10-2020, extending the expiration of existing food establishment permits for up to 6 months and waiving food establishment permit late fees as a result of the emergency due to the COVID-19 outbreak.
Second.
It's been moved and seconded. Any other discussion?
No, sir.
All in favor, say aye.
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 Aye. Motion carries. Thank you, Sammy. Art, you guys have what you need? Okay.
I thank you for your time.
See a thumbs up. Perfect. Item 6 is Board of Health members' health-related activities. Anything that the board would like to report?
Well, I'd like to report on the biggest thing that I get contacted about by citizens about this whole school thing. And I don't know what it's going to take to get the schools opened up, but I'd sure like to know a couple things from the health department that maybe could help us make that decision. What are other counties doing when it comes to schools? Are some doing it and some don't? What about private schools? Are they having outbreaks or not? I would like to know, I read an article recently about Douglas County, Oregon, and it talked about no large spike in the deaths in either Oregon or Douglas County. Just as one geographical area that I was reading about. But I'd like to know from our folks, are we showing a spike in deaths due to COVID in Washington State? So if you went back to 2015 and you gave the total number for 2015, total number for 16, 17, 18, 19, 20, up till November of 20, for an example, what are we showing? Are we actually showing a big spike? Are most of these folks, were they going to die anyway because of something? I don't know that. And I know that sounds kind of callous, but I think our kids are suffering tremendously. And whatever we can do, whatever facts we can glean to help us make a decision, I want those facts. So can you go to the state of Washington and take a look at maybe the counties and the state in general, and give us a list of how many people died in those ensuing years? Do we have a spike? Is it substantial? I mean, I know we're in a problem. Boy, if you catch this thing and it does you in, it's the most serious thing you've ever dealt with. But I really think we need to get some real facts before we continue this third world country business about no schools and shutting down restaurants. I don't know what we can do in opposition to the governor. I don't agree with the governor's actions. I think when you tell an outfit to close down, you should send them a check to cover all their costs at the same time, because I believe it's a taking without compensation. So I am ready to vote, if I had another vote, to do whatever it takes to get back to opening up our schools. It's the one biggest thing my phone never quits ringing on. And I have a listed phone at home, has been for 40 years, and I accept calls regularly from citizens, and I'm telling you, they're fed up, and I hope we can do something to help them out. Thank you.
You have a report, Commissioner?
Gratefully, my family's healthy. We're practicing the distancing, masking, temperatures and all that. I have nothing else other than that. No, very grateful.
I don't have any. I've done a few things related to health-related activities through Thurston Thrives. I sat on a behavioral health siting panel through the State Department of Commerce. They looked for input from elected officials, a few different webinars, but I'm going to move to the health officer's report at this point, which I guess probably segue into some of the comments Commissioner Edwards made. Dr. A, welcome.
Thank you. Good evening, commissioners. We are still in the high transmission zone, so that is 242.1 cases per 100,000 over the past 14 days. We are seeing the results of being in the middle of a surge that started in fall and continues. We are looking to see if the restrictions put in place by the governor can change our disease trajectory. When we do have background levels of community transmission that are elevated, this does increase the risk of outbreaks in workplaces and long-term care facilities. It also increases the risk of outbreaks in schools anywhere where people are gathered. In terms of what we're actually seeing, so as Commissioner Edwards said, some places are open, some places are closed, and in every case, mitigation practices are key. We as a state are looking at the different experiences in different parts of the state as well as the country. And I'm anticipating, and as we look and collect that data, I'm anticipating guidance to come out, and which will be informed both by our experience as well as the experience of other districts and other counties. As far as thinking about deaths, there has been an increase in excess deaths year on year. I will work on getting those numbers. Should they be available? I know that the CDC has noted that there have been excess deaths due to the COVID-19 crisis. We are, even though it looks really bleak right now, it is really important to note that vaccine is on the horizon. So the Pfizer vaccine was recently approved for an EUA, so an emergency use authorization. Moderna will be met upon and analyzed on the 17th, and after that process at the FDA level, as well as approval by the Western States Pact to confirm and look at all of the data as well. If it's found to be safe and effective, that will also be released. Initially, we're looking at a small number of doses compared to our population. So vaccination will occur in phases, focusing on those at the highest risk of contracting the disease. So high-risk healthcare workers, high-risk first responders, as well as folks at high risk of suffering severe outcomes from the disease. So those who work and live in long-term care facilities. There is a framework for allocation for the state of Washington, informed by the Advisory Committee on Immunization Practices, as well as our state Department of Health. Something that's really key for everyone to know is that while a vaccine is really good at preventing COVID-19 disease, it's unclear what the impacts will be on COVID-19 transmission. And so even after we start vaccinating, according to the framework, we will still need to continue masking, maintaining that 6 feet of distance with non-household members, hand washing, staying home when sick, and getting tested. So we do have, in addition to COVID-19, we are doing a number of other activities here in the department. So our disease control and prevention program has investigated 85 confirmed and suspected cases of a wide variety of infectious illnesses, ranging from, Campylobacter to TB to hepatitis B and hepatitis C, among others. We continue to monitor the influenza situation. So far in the state of Washington, influenza activity is low, but we would like to remind everyone to get their flu shot and protect themselves from the more severe aspects of the disease. This is a virus that we do have a vaccine for that's widely available. So I've had my flu shot, and I encourage everyone else in the county to do the same. We also had one more thing I wanted to mention is the shellfish closure at Bud Inlet. So the Washington State Department of Health and PHSS, that's all of us, closed Bud Inlet to recreational shellfish harvesting because of diuretic shellfish poison, which was detected at unsafe levels. So the closure covers the whole inlet from Percival Landing to Cooper Point and Boston Harbor, and warning signs have been posted. So these are toxins that are naturally occurring in algae, but they can really accumulate in shellfish, and they'll make that shellfish unsafe for human consumption. Symptoms of DSP include nausea, vomiting, abdominal pain, and diarrhea. And it's not destroyed by cooking or freezing. So, and this is something that shellfish that are harvested commercially and sold are tested for prior to distribution just to make sure that they're safe to eat. So there's a lot going on. There are a lot of different health issues that we're facing. And I know that working together, we can get through this kind of tough winter period and come out stronger on the other side. Thank you so much.
Question for Dr. Ag? I do have a question for you, Doc. With respect to Commissioner Edwards' comments, I have a couple of questions for you. Number one, you said he was asking for some stats on deaths in other counties for the last 5 years. And you said you can get some of those stats. So my concern or question is, we're in the midst of a pandemic, and this is something that's easy for you to obtain. I wouldn't want to burden our health officer with trying to do research on 38 other counties going back on deaths over the last 5 years. But we got other things to worry about with the vaccine coming in and distribution and such like that. Is that easily accessible?
It is a challenge, to be honest. The CDC does have some excess death reporting data that's available. Getting into the granularity would be challenging.
Okay. And I know you have extensive experience around the world in various countries with various stages of development. Are our policies third world policies? The only reason I ask you, I've never heard it put that way before. Is this what they're doing around the world? What we're doing?
So one of the things that's challenging is one of the strengths of our country is our infrastructure. So communications, roads, all of these different pieces that give us options and compensatory mechanisms. In the developing world, there isn't the resources, there isn't the structure, and so when a disaster hits, everything goes by the wayside, and there isn't the ability, to gather people together, towards a common goal, especially in public health crises in particular, especially sometimes. And sometimes it's hard to gather people for sacrifice when everyone has so little and is sacrificing so much all the time. So we're really fortunate in the US, that we do have resources and that we can engage in public health and disease mitigation measures without, with less difficulty than it would be if we didn't have the infrastructure and the resources that we have here.
Thank you. And finally, the emails that we have received, the public comment that we have received tonight and previously, there's a lot of passion. Commissioner Edwards has a tremendous amount of passion when it comes to the kids in schools and the kids suffering, as do I when we're talking about kids with disabilities and kids that are committing suicide and such. So it can't be minimized. But we don't vote, and we've had people suggest that we vote to open schools. Can you explain that, please, the authority that you have versus what we have as a Board of Health?
Or the school officials?
When it comes to policy setting like that?
So in the county, in terms of school reopening, I have made a strong recommendation to schools I've made a strong recommendation to schools to have remote learning, with the exception of in-person learning opportunities for cohorted groups of 6 students. And this does extend to students in life skills courses. So, and I've left it to each district in the language of my recommendation to determine who in their community meets that high need, that highest need threshold. So the key thing here is that when community transmission is elevated, it's making sure that we have small groups, that we have processes in place to keep to keep people safe, and that we minimize transmission risk. So so what I've done is made a recommendation, and the school districts have accepted that recommendation. If there were to be a significant risk to public health, then we would be looking at more restrictive options.
One of the comments received via email from a constituent, of course, was you used the word strongly recommend, but you could have said I urge, or I really urge, or I encourage, or I really encourage, but still it's not up to the Board of Health or health officer. I mean, you're there to make the recommendations, but it's the superintendents, isn't it, that make the decision whether they're going to open or close?
So we're very fortunate in Thurston County that there's a lot of collaboration between the Department of Health and our superintendents. While that decision ultimately does lie within the districts, we do work together, and we look at the whole context of our county and its communities.
Well, thank you. It's concerning and scaring and upsetting a lot of people, as you well know, because you get the emails too. Thank you.
I have 2 questions, but Commissioner Edwards, you go first.
I really think the bottom line is that the teachers union doesn't want to go back to school, and they're running the show, and the private schools don't have that problem, and their teachers are all there going to school, not having any problems whatsoever. And therein lies the real problem with the superintendent of public instruction's office, with the governor. Unions are running the show, not the medical folks.
Okay, Dr. I got a question on the shellfish. DST, I didn't catch exactly, diuretic something toxins. Can you repeat that?
Yeah, diuretic shellfish poison. So it's
DSP. And is this the kind of problem that there's a specific cause that we can point our finger at? Like, why did this happen? What do we do to fix it? Or is it one of those ones where it's like more non-point, difficult, multiple sources, hard to figure out why that happened?
So it does occur in naturally occurring algae. And it's and so it happened to accumulate in the shellfish in our area. I will definitely chat with our environmental folks a little bit more to determine if there's anything additional that can be done to prevent such a thing in the future. But it is naturally occurring.
I see Art popped up. Art, did you want to weigh in on this question I asked?
Yeah, Dr. Abdelmalek had said it correctly. It's a naturally occurring phenomenon. It's not completely understood. It's a relatively recent development as far as being in the past few years, but it is a nasty toxin and something that, as she said in her notes, it can't be treated by cooking or anything like that. So people want to avoid harvesting shellfish in the closed areas.
So we don't know, out of the gate, we don't know exactly what to do about it. Could be climate change related, or what is the?
It's still not completely understood. It's one of those things where we just have to wait. It's not something where we can say it's due to non-point pollution or failing septic systems or too many nutrients in the water. It's not completely understood at this stage.
Or Victoria.
Victoria or Lots did something wrong or whatnot. Okay.
I wasn't going to say anything about that.
You want me to talk about timber industry?
My second question, Dr. A, this gets to the schools. So I'm getting the same input that everybody else is getting, and there's a lot of it. And I'm not hearing anyone arguing that transmission rates aren't raising. So it's really, the arguments that I hear seem to be either that there's a sense that it doesn't spread among kids in the same way that it would, like why we're not supposed to be in a bar, at a rock concert, at a music festival. With the ability, even and that's not a good analogy, because you could keep people separated, like in workplaces where you could keep people masked, separated by 6 feet. In a restaurant, you could do that, or et cetera. And then there's another argument that it's just, okay, it might spread just as much with kids, but it's okay because it's damaging kids too much to not have school. So those are the two arguments that I hear, and I'm just wondering, is there any, are you aware of any sense that the state and the decision tree and all of that, and the powers that be at the state are thinking along these lines and are gonna are you hearing anything that would lead you to anticipate that there might be some new guidance from the state about the safety of reopening schools? Even if, let's just say the pandemic continues to rage, vaccine's ineffective, pandemic is just going crazy in the spring like it is now in the fall. Is there any thinking that schools can be done safely in person more than they are now? Again, not your opinion, I know your opinion. I'm saying, is there any new thinking happening or new data? Because we're learning so many new things, and there's schools that are experimenting, and you keep saying that we're looking at all that information. Is there any evolving thinking happening at the state, or are they pretty much kind of staying the course with the way they've approached this so far?
Well, I definitely, so there as just like there's a lot of us working on this, there are a number of folks at the state working on this as well. There is evolving thinking, which Director Slaughter and I are a part of. And as that data and as those safety metrics and all of that evolve to reflect our experience here at the state level, then my guidance will take that into account in addition to our public health capacity in terms of doing all of the, because more folks in congregated areas, and once again I'm going to reference these high transmission rates, means a lot of contact tracing. It means a lot of making sure that folks are staying home when they're sick, staying home when they need to quarantine, and doing all of those pieces. In addition, in addition to our hospital capacity for folks who get really sick. So there are a lot of different pieces that go into this. You know, availability of testing. So as we take all of that into account, including any upcoming updates from the Washington State specific experience, we'll be kind of pulling all those pieces together and continuing to work with our schools on trying to extend as much in-person learning as is safely possible. And that's the key here is making sure we have that safety piece, as well as all of the resources we need to support our students, the folks that work with them, and our community.
Okay, well, I had been getting the sense that there, just reading the winds and everything that I see and hear, that there may be a limited expansion of in-person learning, no matter what, after the new year. But I don't want to spread false hope to the community about that if that's not where the state would never go there, and my kids, I got 2 kids, I have a 9th grader and a 7th grader who have been, going through this, and they ask me, and it's really directly to their questions. They want to know if they check those results every day, how many new cases we have, and so, I appreciate those answers. Anything else for Dr. A before we move to Shelley?
No, sir.
Okay, Shelley, close us out with the director's report.
Okay, thank you so much, commissioners, and special thanks to our staff and presenters who have hung out with us so late for 2 months in a row. I really appreciate you, as well as your patience as the Board of Health and taking the time to listen to all of the things that we have going on in our department. Since we have Art and Sammy also on the line, I just wanted to recognize them as leading our COVID-19 business team since Governor Inslee made modifications to our current plan to mitigate the spread of COVID-19. There have been 11 different sectors and pieces of guidance that have been impacted. Guidance for restaurants, bars, religious organizations, many others. They've responded to complaints. They help to support businesses who request assistance in their plans and many other things. They're a very busy group and doing a great job in helping to keep our businesses open and help them adapt to these changes so that we can get COVID-19 under control. I also want to share that they have worked on a campaign in addition to our communication staff that we are really proud of, and that is Mask Up Thurston. So most recently, we have launched a program, again, called Mask Up Thurston, for local businesses to be able to display posters, decals, window clings with a universal signage and language, in multiple languages so that people know that they are required to wear a mask when they enter the business. This keeps the businesses safe as well as increases confidence in patrons of those businesses in accessing whatever services they're seeking safely. So if anyone is interested in where they can get these free materials, there's a variety of partners that are helping us on this effort. The Thurston County Chamber of Commerce, the Downtown Ambassadors, the Lacey South Sound Chamber, the Tenino Area Chamber of Commerce, Grand Mound Rochester Chamber of Commerce, the nonprofit organization Cielo, and of course our department. So if anyone is looking to receive those materials, you can contact any of them or visit our website for more information. So COVID has really changed much of our regular work as well, and I'll just try to, in the interest of time, briefly share some highlights of some things that we have been working on. Our maternal child health program and nurse family partnership has conducted 344 telehealth visits in the last month to women and children in need with increasing and complex needs due to the COVID-19 pandemic. Thanks to the Board of County Commissioners and our veterans Advisory Board's recommendation to expand eligibility for veterans, we've seen applications for veterans assistance to skyrocket this month, just since those changes were made. The rental assistance applications have gone down, but because there's other things that we're now able to help support veterans with, many more are able to take advantage of that. So we're really happy about that. We've also really been focused on supporting youth and young adults who are impacted by the social, emotional impacts of COVID-19. Our staff conducted suicide prevention trainings called QPR. That stands for Question, Persuade, Refer, to our Tenino Bucota Be That Coalition, as well as the Yelm School District this last month. The education and prevention team, which Chris Hawkins leads, helped to coordinate that, and also to offer youth mental health first aid training in our community online, as well as continuing chronic disease prevention trainings online. So all really important. We're going to continue to focus on these efforts into the future. And then our Vital Services program just has a change coming up that I wanted the Board of Health to be aware of, as well as members of the public. Last year, the Washington State Legislature made changes to law regarding vital records. So that includes birth and death certificates. In order to protect people's privacy, they have changed who has access to those records and who can request those. A result of those changes means that Washington State has increased the fee by $5. So it's now $25 to obtain a copy of a birth or death certificate, which we offer at Thurston County Public Health during our in-person hours, as well as online via phone and fax. So more to come on that in January, but that does become effective January 1st. And then finally, I want to save my last comment to give a very special thanks to Commissioner Hutchings. Commissioner Hutchings, you have served as the chair and the vice chair of the Board of Health. This is your last Board of Health meeting. I just want to say on behalf of the entire department how much we've appreciated your leadership. We're really going to miss you. You bring compassion and humor. You're so smart. You ask us the tough questions because you want to do the right thing for the community. You've been an advocate for public health and especially for underserved and those in need in our community, for women and children, leading the Partners for Children group with Thurston Thrives. You've been an advocate for our veterans, for cancer survivors, domestic violence survivors, and those struggling with mental health and substance use issues. And then this COVID pandemic. So hopefully this is a once in a lifetime experience for us, but as we've heard our county manager say many times, this pandemic has really shown true leadership. And you have led by example. Many people in the community look up to you, and you have brought a balanced perspective to really complex issues at times, and you've trusted public health experts. You always appreciate our staff. It means so much to them as they've been working so hard, and use science to make good policy decisions. And you have made an incredible difference during your tenure here. The health and well-being of our community has increased, and you can really be proud of that. So thank you again, and you will be missed. Best of luck.
Thank you, Shelley, very kindly. May I respond? I just want to say
please.
Thank you very much, because I was going to make a comment that the director, you being the director, and worked with you for a couple of years now, and with Dr. Rachel Wood, and then Dr. Diana Yu, and now Dr. Demiana Abdulmalik. It's obvious, you and all your staff and the Board of Health, that we take our responsibility and authority to heart when it comes to public health in both the incorporated and unincorporated areas of the county. It's not dead easy. It's not always black and white. And there's so many issues that you deal with. So we want to be supportive of you as well. Your staff is wonderful. So Doctor, thank you. And Shelley, thank you very much as well.
Thank you, Shelley. County Manager, anything to wrap up? Are we done?
No, I think I just want to say thank you. It has been a trying year for public health, and you have risen to the occasion. The challenges will not end at the end of December. We'll continue on in 2021, and I do believe that we have we're in good hands with both of you. Thank you.
Thank you from the Board of Health to staff, and happy holidays, and we'll see you next month. And Shelley, I'll be seeing you tomorrow.
See you.
All right, we're adjourned.